I was working at the front desk at a hotel, and I went to answer the phone, and it came out blah, blah, blah. I couldn't talk. And my hands and my feet started going numb, and then I fell to the ground.
Kandie Nelson was rushed to the hospital.
They did every test imaginable.
And was eventually diagnosed with a cavernous malformation.
They look like this little raspberry or cluster of grapes in the brain.
Neurologist Dr. Kelly Flemming says a cavernous malformation happens when tiny capillaries divide abnormally and create a tangle of blood vessels. As many as 1 in 500 people have this condition and don't know it, since symptoms are rare.
We find these accidentally. Somebody had a head trauma and they're being scanned looking for trauma, but we incidentally find one of these, or they may have migraines and they undergo an MRI.
Then they can just kind of blow out, and that can cause a hemorrhage in your brain.
Quite often there is displacement rather than destruction of the surrounding tissues, and that's the reason why many patients can have even a significant, fairly large bleed without having major symptoms. This is also the reason why many patients after a symptomatic bleed can have some degree of improvement.
Neurosurgeon Dr. Giuseppe Lanzino says surgery to remove one of these malformations is considered only when it's causing problems, as was the case for Kandie.
It's very close to the surface of the brain, so it would be very easy to get to. So we opted for that.
If it's in a difficult place, like deep inside the brain or in the brainstem, then typically we would wait and watch and only do surgery if there was a second bleed or increasing symptoms.
It's still unclear why a vast majority of people develop these malformations. But in 20% of cases, there's a family connection. And that's true for Kandie Nelson.
So my children had 50% chance of having it.
And 2 of them do, including her son Brian.
They're usually in the brain or the brain stem, but he had one in the spinal cord.
Brian had that cavernoma removed just weeks before his high school graduation. Kandie says a second malformation on Brian's brainstem later affected his ability to walk and talk.
And in his case, we were able to remove the cavernous malformation from the brainstem along with the fresh blood that was there from the recent bleed. And he was able to make quite a remarkable recovery.
My scar starts right here, and it just kind of goes along back and then behind my ear.
In Brian's sister Kayla, cavernous malformation struck in a different way.
And as I was going up the stairs, I remember kind of going into a seizure. So I had texted my mom and told her what had happened, and she was like, all right, yep, you're going to the Mayo Clinic. I'm making an appointment now.
And it was in a particular location in the brain called the temporal lobe, which is common for any type of abnormality to provoke seizures. And even though she went on seizure medications and she tried a second seizure medication, she was still having them. And so if people are having recurrent seizures despite trials of medications, then surgery would be recommended there as well.
Kayla became the 3rd member of her family to undergo surgery and find relief from cavernous malformation.
My seizures are gone.
Hi, how are you?
Nice to see you.
You too.
I think a lot of patients I talk to, this disease is rare even for neurology and neurosurgeons, and so they struggle with finding people with the correct expertise to answer a lot of their questions.
The center here at the Mayo Clinic, we have expertise in diagnosis, both clinical and imaging, the surgical treatment, and the non-surgical treatment of cavernous malformations.
And thanks to families like the Nelsons, that expertise continues to deepen.
All 3 of us have donated our malformations to science so that hopefully they can try to figure out how they grow and what they can do to stop it from growing. You know, God puts you here for a reason. I believe one of my reasons is to help find a cure for this.
For the Mayo Clinic News Network, I'm Jeff Olson.